From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. What if I told you that there's a treatment that can smooth fine lines and wrinkles, reduce hyperpigmentation, and completely refresh your skin, all while boosting collagen for long-term results? Sounds pretty amazing, right? That's exactly what CO2 laser resurfacing does, making it one of the most effective treatments out there for skin rejuvenation. We're excited to have Samantha Pino, a family nurse practitioner, with us today to answer all our questions about this game-changing treatment. Samantha is the founder of Face by SP and an expert at blending science with aesthetics to help clients achieve natural, long-lasting skin transformation. Whether you're thinking about CO2 resurfacing for acne scars, sun damage, or just want that fresh, youthful glow, she's here to break it all down. How it works, who it's for, and what to expect before, during, and after. Samantha, welcome to the Care Experts podcast.
Thank you for having me.
Before we dive into CO2 resurfacing, I would love to know how you got into this work.
So I got into the aesthetics field after being a nurse for quite some time. So I was a registered nurse for almost 6 years. I did critical care, I did cardiac, surgical, a little bit of everything. Loved it and miss it every day. But when I was ready to kind of take the next step and become a nurse practitioner, and I was seeing what I wanted to specialize in, I was really honed in on pediatrics, actually. And then one day something popped up on Instagram in my Explore page, and it was an academy in London called the London Academy of Aesthetics Medicine, which is where I trained. It's owned by Dr. Wasim Taktok and Dr. Tara Francis, and they were getting into like the anatomy of the aging face. It was like a post, and I was like, what's this? Clicked on it, and it was a rabbit hole from then on out. I loved everything about what they taught regarding the anatomy of the aging face, and that kind of catapulted me into looking into what aesthetics was really about. I think traditionally I thought what most people did, it's Botox fillers, and that's about it, but this just led me into a whole new world that made me very excited. Went to London, trained with them, and the rest is history.
And now you have your own clinic in Miami.
I do.
Wow. Sometimes you just know. When you know, you just know.
It was one day to the next and I knew.
Oh, well, I'm so excited to talk to you all about CO2 resurfacing. And to kick the conversation off, I have 3 questions for you. Are you ready?
Yep, I'm ready.
If you had to describe CO2 laser resurfacing in 3 words, what 3 words come to mind first?
I would say worthwhile. I think even though it maybe has a little bit of downtime and it's a little bit more of an aggressive treatment, the results are unmatched.
Yes.
So definitely worth the time and effort. I would say regenerative, which is a topic we're going to talk about a lot today, but it's one of the regenerative treatments that is, kind of taking the limelight now.
Yes.
And I would say glass skin, because everybody wants that nice, tight, youthful skin, and it's one of the best ways to get there.
Okay, worthwhile, regenerative, and glass skin.
Yeah.
What's one myth about CO2 laser?
I think the most common myth is that it's very painful and that the downtime, it's, too much for some people. Yeah. But I do think it's a myth in a certain way because there is so many different types of CO2 lasers and degrees of CO2 lasers. So they have varying downtimes. And we have so many methods now in terms of making our patients comfortable that it's very tolerable.
Okay, amazing. What's one thing you want everyone to know, one thing that feels really important or a fun fact about CO2 laser?
I'll say a fun fact.
Okay, great.
Because we'll get more into the science behind it. But a fun fact is it's actually used in the industrial world as well. And they use it to engrave like plastics and metals, which sounds scary. Obviously, it's a different form of CO2, but it just goes to show like what a powerful and precise device it is. And when we bring it into aesthetics, obviously in its different way, it's just as powerful and precise.
Oh, I love it. For somebody who's never even heard about it, what is CO2 laser resurfacing?
So let's start with what does CO2 mean? So CO2 means carbon dioxide. So essentially it's a gas, and the laser uses this gas mixture that's mainly composed of carbon dioxide. It releases kind of like an electrical discharge. When it comes in contact with that gas mixture, it creates a series of reactions that then ends up with this infrared light that the molecules, the water molecules of the skin absorb. And that's how we're able to get underneath the skin and heat it and cause this, what we call controlled thermal damage. So basically a controlled way of injuring the skin through heat and then starting this regenerative process to heal the skin. And that's where all these young, youthful, collagen-rich cells start to form. The tissue remodels, and we have like this new thick, plumpy tissue. And essentially any of the regenerative lasers do the same thing, but through different forms of damage.
Okay. So it's damaging the skin, but in a safe way, and in a way that actually ends up having the body repair itself, produce more collagen, and then give us that youthful look that we're going for.
Exactly.
What kind of things can this treat? What sort of imperfections or issues?
It's a wide range. We have fine lines and wrinkles that it can treat, acne scarring, or even scarring caused by trauma or surgical interventions. It can treat melasma. So that's a common thing that we see. I'm assuming in California, we see it in Miami a lot. Melasma is basically hyperpigmentation of the skin, but it can be caused from not just the sun, also hormonal changes, women in menopause, pregnancy, postpartum. So it helps treat that as well. And then texture and pores, which is something that's very common that people complain about. And that goes back to that glass skin appearance that we all kind of want. I do think it's important just to throw in there that pore size and texture is very genetic.
Yes.
So it's not something we can change, but we can alter it. And these resurfacing treatments help with that quite a bit.
I love that you just noted that, because I think it's important when we're having these conversations to also note that pores are normal in skin,
absolutely.
and we're going to have different textures in our skin. So none of these procedures that we're talking about are meant to completely erase that, but more to enhance your natural beauty. And
Absolutely.
And
it's
to
part
give
of
you
our
that fresh
character.
look. Love that. Okay, so are there any individuals who CO2 laser resurfacing would not work for? Any skin types?
Yeah. In terms of not working, I think we have to be realistic with our patients, because let's say someone has very deep-rooted acne scarring or very deep wrinkles or ritids of the skin. You know, we want to be realistic with them. Can it improve it? Absolutely. But is it going to remove it? Probably not. We probably need to bring in other modalities. But I do think it's important to note who's not a candidate. So we always want to be wary of, with lasers in general or radio frequency devices, darker skin tones. We want to be a little bit careful, because the melanocytes, which are the cells that carry our melanin, our color, attract these lasers or these infrared lights, and it can cause hypopigmentation or skin changes that we want to be careful with. If you're prone to keloids, which is like pore scarring or healing of tissue, you want to be mindful. And I think anything in aesthetics, if you're pregnant, breastfeeding, it's kind of a no-go. They're not studied. It's not something we want to study. We don't want to know the effects on a fetus. So yeah, that's the basis.
Okay, amazing. Can men do CO2 resurfacing even if they have facial hair? Like, are you shaving that off?
Yes. So it depends on the area. Sometimes it will be shaven off. Typically CO2, depending on which one, is not going to affect the follicle. There's obviously lasers that target the follicle for hair removal and things of that sort. But it does depend on the area. Men tend to have thicker skin because of their higher testosterone level. So they may need some more treatments or a little bit more aggressive treatments. But it's beautiful for males with acne scarring or really rough textured skin.
Amazing. On that note, what can somebody expect when they have a CO2 resurfacing laser? What are some of the benefits?
I think the regeneration of the skin is the main benefit. So in terms of the science behind it, it's creating what's called the healing process to kick in. And that has multiple phases. We have like the inflammatory phase, where all these cells rush to the area to repair the damage that we caused by the laser. That in itself already helps the skin look better. But then we have the proliferation phase and the remodeling phase, where now we're physically remodeling what our tissue looks like underneath. And that's where that scar tissue development comes in. So we're getting that long-lasting result, because once tissue is remodeled, it's hard for it to go back to baseline, right? The aging process is still going to occur. We're still going to lose that collagen, but we're getting way ahead of what's going to happen. But that's where some of that downtime comes in, right? We need that healing process to take its course, but it's so worth it at the end.
We're going to talk a lot about what the actual procedure looks like and what that downtime would be, of course. I'm curious whether or not you think, like, is there a time that you would want to start doing this, or a certain age that you would do this type of procedure? And how does it compare to something like microneedling or a filler or a chemical peel?
Okay. I think in terms of age, it depends on the patient and what we're targeting, because there is some younger clients who have acne scarring from, pubertal acne or hormonal acne, and, case by case basis, sometimes they are good candidates. But if we're talking about it more in its regenerative sense, I would say we really start to lose collagen from 20 years of age. My favorite statistic to tell my patients to not scare them, but get them thinking is we lose 1% of collagen from the time we're 20. So that's already 10% by the time we're 30 and 20% by the time we're 40. So we want to think of that timeline when we're thinking, when should we start these resurfacing or regenerative procedures? I like to say mid to late 20s is a good time to start. Not necessarily with just CO2, patient dependent, but it's one of the options in our toolbox.
Amazing. Let's talk about what the appointment actually looks like. So if somebody's listening and they're like, I need this, I want this, I'm excited to find out if I'm a good candidate for it, they show up at your clinic, and what happens from there?
Consultations are always first, and that just gets you to understand your patient's needs, their wants, and what you think they need, because sometimes what they want is not what they need. So consultations are important, and seeing if they're candidates and they don't have any contraindications. So typically that's going to be the first process, and typically treatment won't happen first day. But sometimes it will. So after consultation and that discussion, if you're a candidate and you come in for treatment, typically you're going to get your skin cleansed and thoroughly cleaned to make sure it's prepped and ready. And then the numbing, which is the most important part. And the nice part is we have so many new options, right? You have your prescription topical numbing creams, which are nice and strong. There's nerve blocks that you can do. If it's going to be more aggressive, ablative CO2 lasers, sometimes it'll be done under general anesthesia in an OR setting. If you're already, typically that's only done if you're already getting some sort of surgical intervention like a facelift. But you'll get your numbing. The procedure will start after the numbing has kicked in. Could be anywhere from 30 minutes upwards to a few hours, depending on the area. And then your skin will be cooled afterwards with some sort of emollient. It'll be protected. You'll get your post-care instructions, and you'll be well on your way, and then a follow-up in about 4 to 6 weeks.
Okay, amazing. Is there anything that people should be aware of when they're looking for a provider? Do you need to be a nurse practitioner in order to do this, or can anybody do it?
I think it varies state by state. I know in California, RNs, nurses, are allowed to. Typically, you do need to be certified, and you need to have a laser certification as well, not just a degree as a nurse practitioner, physician assistant, doctor, just so that you know how to operate the laser properly. Just looking for someone who's reputable, do your research, reviews are important, and then always have a consultation and a sit down, maybe with various providers before choosing where you feel comfortable.
All right. So you've done your consultation, you've talked to a provider that you trust. Now you're going in for this treatment. It's going to be a couple of hours while you're there. Is it painful at all?
It's uncomfortable. I think anytime you're having heat to the skin, especially with lasers or radio frequency, you're going to feel it to a certain extent. But these analgesic options that we have, these numbing creams and things of that sort, holding like cooling devices to help the patient, even like a stress ball helps so much. Maybe playing some music, things that just make you feel more comfortable. It's definitely tolerable. I don't want people to be scared of these things. It's more the unknown that worries people. Once you're there and you're getting it done, you can do it.
Absolutely. I have done a halo treatment, and I absolutely loved it. I would say it kind of feels like a bit, it's a little bit stingy, but it is so tolerable. And then hot afterwards. But it was really interesting with the heat that I felt afterwards. After 1 hour, it completely disappeared.
Absolutely.
Like within a moment, it was just done. It was done. I don't know. Clearly, we'd gone to the next phase of healing. And then the results were so worth it, for me at least.
It's worth it. I always say that at least any discomfort we go through within, anything in aesthetics and minimally or non-invasive, we have like the aftermath to look forward to. So it's worth it. That heat you felt, it's because the heat kind of stays trapped for a little bit under, but then your body slowly starts to release it. It's like a sunburn.
Yes.
If you've ever been sunburned, you can do a CO2 laser. You'll be fine.
Yes, exactly. And then what's the downtime like and the aftercare for this procedure?
The downtime varies. Everybody heals differently. So I'll give you like parameters. If you're doing like a non-ablative CO2 laser, which is a little bit gentler, I would say a few days to a week or so of feeling kind of those sunburn-like symptoms. If it's more ablative laser or like a fractional CO2 laser, probably a few weeks. Aftercare helps with the healing process and helps speed that up.
Yes.
So in terms of aftercare, sun protection is going to be key. Wearing your sunblock, even if you're indoors, UVB can get in through almost anything.
Yes.
And avoiding direct sun. Be prepared to not exercise or wear makeup for about a week to 2 weeks minimum. And I think that's what kind of puts people back a little bit, is like, I can't wear makeup, I can't exercise. You can go about your day-to-day life. If you're at work or you're out in the grocery store and you're a little red, it's fine. Nowadays, I feel like everyone's like, "Ooh, what'd you do? Can I do it?" It's like walking marketing.
I showed up at school pickups, hockey drop-offs, all of the things.
It's
you kind of just have to own it. And yes, I mean, I also wore mascara. Is that wrong? Like, I feel like that's touching a different part of your face.
Mascara and a little eyebrow gel is fine. A little lipstick is okay.
Yes.
As long as we don't want to introduce bacteria to the skin. So I always tell clients, like, whether it's with microneedling or chemical peels or lasers, change your pillowcase. Don't put your phone to your face. Wear your AirPods or put it on speaker. Things like that. It's like little minute things that are easy to do.
And ideally, we're kind of doing those things anyways, changing over for our skin health as well. Okay, amazing. So we've done the treatment. The heat has started to cool. Now, what can we expect from the next couple of days? We know that there's some downtime, but is it going to get dry, red? Like, what are you looking for to show that the treatment's working?
After that initial like inflammation, redness, sunburn-like feel, your skin will start to crust over a little bit, almost like peel, get dry. Obviously, different extents depending on the patient and which laser you did. But that's kind of the next phase. And then from there, this new cap of skin starts to show. And that's where clients start to get excited because they start to see like this new resurfaced skin show. And that's typically at about the 2-week mark.
Okay. Any hero products that you would recommend for individuals in that state? Like, are there specific moisturizers or anything that you want to use on the skin, or nothing? We're just leaving it.
You want to use things that are going to help the skin barrier. The hero product is sunblock, in my opinion. But in terms of healing, I think emollients, anything that's like emollient based, and typically your provider will give you like a cooling mask or a cooling gel or something to help protect the barrier, but also help with the itchiness that comes from that dry phase of your skin.
This is a question I've been wondering for so long and haven't had the chance to ask somebody. There's so much conversation right now about protecting our skin barrier and not using things that are going to damage that. Does this damage that, or can you talk to me a little bit about that?
So we're working on the skin from below upwards, right? So when we think of our skin barrier, we think of like, what are the external factors that can damage our skin barrier? So like overusing retinols, overusing acids, exfoliants. So again, so many clients come in because of TikTok and other things, and they're using all of these different types of acids. Those are the things that can affect our barrier, especially if we're younger, sun damage, things of that sort. When we're dealing with like a controlled sort of damage, like with these lasers, it's very different. If you abuse of it or you overdo it, or it's done improperly, potentially. But luckily, our skin bounces back nicely. And even if you have a damaged barrier, you can work at repairing it.
Okay, amazing. Any major do's or don'ts post-treatment or during treatment?
Post-treatment, major don't is getting sun, especially when the skin's healing from any treatment. If you get sun, you can have scarring and pigmentation that occurs. Major do is wearing sunblock. I think I've said that like 3 times, but it's important. It's key.
It's so important.
You've invested.
Especially after having these treatments and like get your hat on, get your sunglasses on, protects the investment.
The crazier you look, the better.
Okay, we talked about it a little bit before, but I feel like this is something that everyone's going to want to know and be certain of before deciding whether or not this is the treatment for them. What is the difference between CO2 laser resurfacing and microneedling or a chemical peel?
Okay, I love that question. I love microneedling. I think I embed this into all my patients. But I equally love CO2 and chemical peels. I'll tell you a little bit about the difference. So they're all causing some sort of damage to the skin in a controlled way, right? Your chemical peels, think of them as like strong exfoliants, right? So they're shedding the outer layers of the skin anything that's damaged, kind of just sitting at the surface, not doing us any justice. Our microneedling is controlled damage through needles, right? So it's still going through that healing process and creating that collagen and that remodeled skin, but because of needle damage. A little less downtime than CO2, which is nice, but similar. You're going to be red, a little sunburn-like feel, maybe like a week of downtime or less. And then your CO2 is that thermal damage. So all ways to resurface the skin. When you combine things, it's always going to be a better option and a better result for longevity. So again, depending on what your patient needs and what they're capable of doing, that's where you choose the options.
Okay, amazing. My next question was, can you do CO2 laser resurfacing with something like microneedling or Botox? If you've had fillers, are there any things that do not pair well with this treatment?
They all pair well in the sense that they're all targeting different things. You obviously don't want to do them close to each other. There's like timelines that we follow. And that just depends on, which treatments you're pairing. Specifically with the filler and the Botox, you do want to be careful not to do anything too close to doing those treatments because you can overheat the gel or you can cause the neurotoxin, the Botox, to move to another muscle. So we typically have at least for Botox 2-week range that you want to be mindful of. Filler, it's a little bit longer. So it just depends.
And that's something you would just want to talk about in that initial consultation with your provider, being really upfront with your goals and then what you've done in the past. So that you can work together to create your best skin ever.
Yeah, exactly. So like we typically create a year-long timeline, and that's kind of where you mix and match different things. At the end of that year is when you're like, wow, this was worth it.
I love that you just said that, that this year-long timeline is what you're working with. Because really when we look at anything in health and wellness, whether it's developing a new workout routine or changing your diet, I feel like a year is really what you need in order to start seeing results, feeling full results. I mean, of course, we can notice changes before that, but to really create that longer lasting, sustainable change, that mindset of giving yourself some time is so important.
Yes. Being patient is key. It's worth it. And you'll see, you'll have those times in between where you obviously see the results, as you mentioned, and you get excited. But being consistent is always going to be the best result, and it's going to give you the longer lasting result.
Amazing. So Samantha, we always do a segment at the end of the show called Ask Me Anything, where our amazing audience has written in with their questions. We've got some good ones for you on this topic. Question 1, can I bring a friend with me to the treatment, or is it unsafe because of lasers?
It's a good one. You could bring a friend. Moral support is very welcomed. Typically with lasers, we're just mindful of vision. So they'll need special glasses, or sometimes providers will have them wait outside and you can have them as moral support before and after.
Gotcha. Question 2, how soon after a CO2 resurfacing treatment can I resume wearing makeup?
Typically we say 2 weeks, and that's kind of like the gold standard for a few of those resurfacing treatments. More so because we don't want to introduce bacteria to the skin. And the skin's healing. You kind of want to let it do its thing. You won't want to wear makeup.
No. You're going to give yourself a second. All right. I get a facial every month and use a retinol at night to maintain my skin. Do I need to stop using them before a CO2 resurfacing treatment?
Yeah. Before a lot of these treatments, even microneedling and peels, you will want to at least a week before. And not just retinols, but any strong acids, strong exfoliants. You just want to give your skin a break, back to that barrier thing, so that it's not sensitive when we introduce this sort of damage to it.
Perfect. What are some potential side effects I should be aware of after CO2 resurfacing?
So uncommon side effects would be some sort of hypopigmentation of the skin, scarring, infection. Not very common, but it's things that we do discuss with our client. I would say more common ones are like the redness, the swelling, the peeling, the itching. So telling your client that beforehand is important so they know what to expect and they don't freak out. Beautiful.
Last question. Is there an age where it's too early to get this done? I just turned 30 and I'm wondering if I should wait.
There is an age that's too early because, we don't want to get ahead of ourselves. And that's something we were talking about earlier too, before starting. I think especially because the younger generation is so exposed to all of these options now through social media, we do want to put a halt to it and know when is the right time and place to do these things. But 30 is a great age because, like I said, we've lost 10% of collagen by then. I always say or I heard this somewhere, and I don't want to say that I created it, but it's proactive treatments versus reactive treatments. So we want to do them before the aging process has gotten to the point where maybe we need things that are more aggressive. So mid to late 20s, early 30s, great time to start.
Amazing. Thank you so much for joining us for this episode. I learned so much about CO2 laser resurfacing. You're such an expert in this area. Where can everyone find you?
I'm located in Miami. I have an office in Doral called Face by SP. And we also have a training academy with the London Academy of Aesthetic Medicine.
Amazing. Thank you, Samantha.
Thank you for having me.
Thanks so much for listening. If you liked what you heard, give us a 5-star rating and don't forget to subscribe and follow on your favorite podcast platform. New episodes drop every Wednesday.
For information and entertainment purposes only, not to be construed as medical advice. Consult your provider. The CareCredit credit card is subject to credit approval. The information, opinions, and recommendations expressed in the episode are for informational purposes only. Information has been obtained from sources generally believed to be reliable. However, because of the possibility of human or mechanical error by our sources or any other, Synchrony and any of its affiliates, including CareCredit, collectively Synchrony, does not provide any warranty as to the accuracy, adequacy, or completeness of any information for its intended purpose, or any results obtained from the use of such information. All statements and opinions are the sole opinions of the doctor being interviewed. The data presented in the episode was current as of publication. Please consult with your individual advisors with respect to any information presented. All products, services, and company names are the trademarks of their original owners. The use of any trade name or trademark is for identification and reference only, and does not imply any endorsement, sponsorship, or affiliation by or with the trademark holder of their brand.